I'm Jacqueline Bissonnette from the Psychology Department of the Greater Essex County District School Board, and I'm here with my colleague.
Hello, my name is Sartia Deonarain. Today we would like to talk to you about recognizing signs of stress and anxiety in children and adolescents.
So we're here with another podcast to help families through this really challenging time that we're all experiencing as a result of COVID-19. Today, we're going to review some tips from the American Psychological Association on how to identify signs of stress in our children and teens. The article we're using as a reference is linked on our website, but we want to use this time to discuss and highlight some of the ideas presented in the article.
Absolutely. We know that everybody, including children, adolescents, and adults, all experience stress at one time or another. Stress comes from many different sources, including school or work and our relationships with other people.
Exactly. We can experience stress resulting from the expectations that we have of ourselves or that we feel others have of us. Sometimes stress can be positive. It gives us energy and motivation to do a really good job. But sometimes stress can be just too overwhelming. At that point, it makes it harder to get things accomplished and can really make us feel out of sorts.
Exactly. As caregivers, educators, and other people involved in kids' lives, we can look for cues or red flags that they might be experiencing these really overwhelming levels of stress. Then we can provide some supports to help reduce those levels of stress.
So where do we start? The American Psychological Association's article highlights a few things that we might be able to look for, including physical, emotional, and behavioral signs of stress. First, the American Psychological Association suggests that we monitor our children and teens for changes in their behavior. On occasion, everybody struggles to verbalize or put into words how they're feeling, regardless of their age. Children tend to have even more difficulty doing this, so instead of relying on their words, we should look for changes in their behavior.
Exactly. We might notice that our kids are a little grumpier than usual, or that they are not doing those activities that used to bring them joy. They might be complaining about things more often or talking about worry more often. Some might seem a little bit more on edge or jumpy, and some might be demonstrating some changes to their sleeping or eating habits, such as sleeping more or less or eating more or less than usual.
All of those are really good cues. But we need to keep in mind that there might be some changes in these things, like the sleeping more or less or eating more or less, that simply come from the fact that we're home now because school is canceled.
Right, and I think that we need to give a little bit of caution in interpreting physical complaints, such as stomach aches or headaches or chest pain or feeling more tired than usual. Complaints of illness or not feeling well is another set of signs that we should look for according to the American Psychological Association. A lot of those types of complaints usually signal that a child is feeling more stressed than usual. We definitely want to make sure that none of these physical symptoms are aligning with symptoms of the illness caused by the coronavirus.
Right. So usually when we're talking about these types of physical complaints that are related to stress, we want to make sure that the medical causes are completely ruled out. So if there are medical reasons for these sorts of physical complaints, we want to make sure that those are taken care of. We want to make sure that children are physically well. If we can notice patterns in these complaints of illness, like feeling sick before a big test or feeling sick before having to give a presentation in class, we have a better idea that these complaints may be related to stress. But I think one of the difficult things that we're facing right now is the fact that with schools closed and everybody staying home, it's more difficult to see those patterns.
That's right. We might see those patterns in terms of exposure to media, including social media or news. For example, exposure to reporting about COVID-19 symptoms, statistics, or medical treatments might cause higher levels of stress in some people. It might be important to limit exposure to media in such circumstances. That being said, it might also be more difficult to see patterns in physical complaints because of the circumstances we are in right now.
Right. Well, the third tip provided in the article involves paying attention to how children interact with other people and how their interactions may change depending on where the child is. So some children might be fine at home, but they're demonstrating some changes in their behavior in other settings like school. again, right now with everybody staying at home, it's going to be more difficult to be able to observe those changes in interactions with others. You might notice some changes in how your older child or teen is interacting with their friends during telephone calls or video chats or through their interactions on social media.
Absolutely. Let's talk about the final tip provided by the American Psychological Association.
Okay, well, the final tip has to do with paying attention to what your children are actually saying. They might be talking about feeling worried or confused or annoyed or angry, but they might never actually use the term stress. So it's up to us as caregivers and educators to translate what the kids are actually intending with the words that they are using. We have to do a little bit of reading between the lines.
We have to do a little detective work. The examples you provided use a lot of feeling words, but we also have to pay attention to how our children are talking about themselves or others. They might be more negative than usual, saying things like, "No one likes me," "I don't have any friends," or "Nothing is fun." So when you hear these sorts of words or statements coming from your child, you have to try to figure out why they're saying "I'm bored." It might be a very common phrase heard by caregivers these days, but we don't want to put aside how that reflects what kids are feeling.
Good point. I think that the American Psychological Association is really encouraging us to look for red flags that might signal that our kids are having a rough time. And we might say that everybody's having a really tough time with the changes that have happened around the coronavirus, but we want to make sure that we're still meeting our kids where they are and meeting their needs.
Exactly. So please visit our website, publicboard.ca, to read the full article. And if your child is having difficulties as a result of anxiety or stress related to the coronavirus, consult a healthcare professional such as a doctor, psychologist, or social worker.
To sum it all up, this is a difficult time for us all. Do the best you can. Be kind to yourself and be kind to your kids. And thanks for listening.